Hi, my name is Dr. Cynthia Shaw. I'm a licensed clinical psychologist and owner of Authentically Living Psychological Services. I'm going to talk about a few of the services that we offer at our practice, and one of those being grief. So we offer grief services mostly in the format of one-on-one therapy, and there's a number of different forms of grief that we work with as existential, holistic, trauma-informed therapists at our practice. So of course we see typical loss, right? Loss of a loved one via death, chronic illness, a terminal health ailment, loss, right? Loss of a human, loss of a loved one, right? And then on the other end of the spectrum, we also work with disenfranchised loss, whether that be a loss of a dog or a fur critter, the loss of a romantic relationship because of a breakup or divorce. We work with miscarriage, abortion, infant loss. We also work with loss of identity and freedom, whether that be due to incarceration or some run-in with the law. We work with loss such as job loss, right? And that also kind of falling under like the loss of identity. So these are all different forms of loss, not just in the typical sense that we at Authentically Living work with. Grief is an area of mental health that is very important to me and I'm super passionate about. As someone who has struggled with many different losses, both in the loss of loved ones as well as the loss of like physiological functioning due to chronic pain and a lot of physical ailments throughout my history, I'm really sensitive to loss and how it can affect a person and every area of their existence. I'm very sensitive to medical trauma, the invalidation that people experience when talking about loss, and just the loneliness that comes with grief, right? And how whatever anyone says, it's just wrong, right? And all the emotions and varying experiences that come with loss, whether that's anger, frustration, overwhelm, sadness, maybe even happiness at times, or relief about that loss. I'm really passionate about creating space and sitting with a person as they're navigating all those complexities. As an existential psychologist that works a lot of the time with grief, I often find that existential inquiry comes up a lot with the clients that I work with. People who are struggling their own death and mortality and what it means to be an aging person, a body that will continue to decline as time goes on. A lot of the times when people lose a loved one or spouse or a child, a friend, whoever it is, it often brings up questions about a person's own mortality. Like, what is life in knowing that, right? With that, I often find isolation and loneliness is huge, right? Unless you have experienced some kind of grief or loss, it can be very difficult to connect with another person after you have experienced a loss of a loved one or a loss in another form. I think what's unique to our services outside of just kind of processing loss and identity and loneliness and health anxiety and mortality and all these big existential questions that come up with loss, I think a unique area to our approach is just the person-centeredness of it all, right? There really is no timeline when it comes to processing grief. You could be feeling really good one week and then out of nowhere just kind of get sucked back and or feeling it all over again and feeling punched in the stomach and just this huge wave of emotions. And so I really value approaching therapy in a very person-centered way, especially in the context of grief and loss. And I don't think there should be any pressure for someone to get on with their lives after this loss, right? I think there's societal pressures that, oh, you have 1 year, you get through the first holiday, the first new year, their first birthday, the first anniversary, and then, we're done with, right? And that's just not the case. Acceptance is also a huge piece that I pride our work around, especially when it comes to the coping skills that people are using just to get by. It doesn't matter how harmful, and not to the extent that I don't care, right? Some of these coping skills that people are using can be significantly harmful. And also, this is a judgment-free space, right? So whatever it is that a person is using, it's protective to them in that moment. And so not invalidating what a person is using and not trying to take away just because there's some judgment about like, oh, you're drinking too much and this is bad and not good for your health, blah, blah, blah. I think it's a matter of accepting what a person is doing at the moment and how it is that they're choosing to take care of themselves, and inquiring as to whether they want to take care of themselves differently, right? And what that looks like. Another area that eventually unfolds in the therapy space when doing grief-oriented work is connection, right? And connection with yourself and other people and your larger world contacts. Again, similar to the identity piece that I mentioned earlier, and kind of assessing who you are through all of this and examining these very large existential questions. A huge area that comes up in the space is connectivity and the relationship that we have with ourselves and everything around us. I always say that no stone gets unturned in the therapy that we do. We're very explorative and open, person-centered, relational, and just human. If you are struggling with grief or know someone who is, like I said, whether that is grief in the sense of a traditional loss or a non-traditional loss or disenfranchised loss, such as chronic illness, job loss, relationship loss, and you're interested in inquiring more or potentially starting services, please feel free to reach out at authenticallylivingpsych.com. There's a lot of different submission forms and contact pages all throughout the website, or you can also message us at 312-600-3775.